Good afternoon, everyone. My name is Kathy Still. I'm president of the board of directors of the Veterans Community Action Network of South Central Wisconsin. And on behalf of our board, welcome to this month's Community Engagement Forum. We're excited with today's featured guests and invited guests. We have Karina McVeigh representing St. Croix Hospice, and she is going to share with us the hospice services that are available to veterans through St. Croix Hospice. And then we also have Margie Mortal. Did I pronounce your last name correctly?
Well, that's always a trick. It's Myrtle.
Okay,
Both
Margie
names are
Mortal.
tricky.
Um, with from Embrace Your Inner Self, and she is a doula, an end-of-life doula, and is going to share with us those services. And we're looking forward to having some discussion on this and answering any questions that you might have. So just I do want to highlight some things things that are happening with VetsCAN. So we've taken the summer off, and here we are back in September, and ready to get going for fall. So I want to announce a couple of our upcoming activities. Next month, our engagement forum will be on October 16th, and will feature Mr. Stephen Rose, Executive Director of Fisher House, Wisconsin. We're really excited to have Stephen talk about the important role that Fisher House plays in enabling veterans to obtain VA care while having their family or their loved ones and support system with them. A Fisher House is coming to Madison, and he's going to share with us what's happening and what that means for veterans that receive care in the Madison area. And if you have never heard of Fisher House or don't know what Fisher House is, as long as there's nobody from the Ronald McDonald House company or corporation here to scold us, Fisher House is similar to a Ronald McDonald House, but for veterans. They began on military installations and were to provide free housing to family members of service members that were hospitalized or receiving care. And now Fisher House has expanded to also support our VA hospitals in that way. So this is a wonderful development for veterans that receive care at the Madison VA, and we're excited to have Stephen join us next month at our engagement forum so that we can learn more about that. Then in November, please mark your calendars. November 20th, we'll be holding an in-person event. We did this last November, and we're looking forward to doing that again this year. And part of that will be a panel discussion about the needs of veterans and how the community can come in alongside veterans and help bridge the gaps in care that they may not be able to receive the care or services from the VA or through other government programs. And so we're going to talk about how community providers and how the community can step in and help close those gaps in services to meet the needs of veterans, their families, and their caregivers. More information is going to be posted on our website and will be pushed out through our newsletter, but that will be November 20th from 4 to 6 p.m. at the Lake Windsor Country Club in Windsor. An initiative that I think we've mentioned previously is our the initiation of what we call our QRF grant. And in military jargon, that's kind of a quick reaction force, QRF, and it's for fast response. And what we wanted to do was be able to quickly respond to veterans' financial needs. And we've designed this grant to provide emergency funding to veterans, but to do that in an extremely expeditious way. So this is a program that we are piloting right now in 2 counties, in Greene and Richland. We're looking to also include Dane County in that. And once we work out the kinks, I think we're looking forward to expanding this program beyond those 3 counties and throughout our region. So it's something that we're really excited about. And Keith, do you have anything to add about, Keith is our vice president, anything on the QRF or anything else that I've
Well, so far, I think we've had 3 applicants, and these folks are screened. We get the referrals from the County Veteran Service Office. So our hope is that there's some verification of need that occurs at that level, and we've capped the amount of money that a given person or family can receive in one given year. I think it's at $500.
Mhm.
Yeah, the goal was to take the bureaucracy out of the process and to do it as fast as possible to help the veteran. So as Kathy's indicated, we're in a testing phase. We will see how this goes. There's always some risk that somebody might want to take advantage of you, but I think the benefit of being able to respond to need outweighs that. And by and large, maybe I'm trusting that I think people come forth with regular needs, food, transportation issues, clothing for their kids, et cetera. So we'll keep you up to date on what's going on, but I'm really happy that we're able to do this, and hopefully we'll get the support of additional county veteran service officers as we move forward.
Thanks, Keith. Okay, so why don't we move on to on our agenda? I see that and the first thing up is the VA hospital updates. I see that. I think that it's Abe that's on. And hey there, Abe.
Hey, Kathy.
Hey, oh,
How's
what
everybody
can you share
today?
with us today?
Just a couple of notes from the hospital. I'm just kind of getting back into the swing of things after being down in Rockford earlier today, where we had a open house at our Rockford clinic. It was a really great turnout in Rockford. We had literally a consistent line of veterans who were in our lobby, kind of waiting for quick appointments to assess their eligibility for care, and to enroll in care. So I know we had 400 bratwurst for the entire cookout, and when I was leaving, I think they were down to their last few. So it was a really active, well-attended event. We had a ton of resource information out there for veterans, a lot of really happy people, a lot of people impressed with the clinic. So just a really nice outreach effort down in Rockford, and hopefully we get quite a few veterans who will look at us very carefully and hopefully choose us for their healthcare. So that was one thing. Yesterday, we also had our teletown hall. A few highlights from the teletown hall. One thing for just general awareness, we're going to be doing some communications out to veterans that we are going, for many of our veterans, we currently have prescriptions which ask them to split pills in half. So for example, they might get a 10 milligram dose of a medication and be asked to split that in half into 2 separate 5 milligram doses. As there's kind of a 2-prong reason for us moving away from that. One is it's just easier for veterans to get the correct dose without having to split pills. So this is a good news story for veterans who no longer have to worry about splitting their medications, but it's also something that is a requirement for our transition to the new federal electronic health record. So we'll be sending out communications. We have a nice postcard designed for all veterans who currently have a prescription that is asking them to split pills in half, and we'll be starting an information campaign to ensure people are aware that that change will happen, and to just be a little extra cautious if they had been splitting pills to make sure that they're reading the dosage label and following the instructions. The doses will be updated when a new prescription is filled. So it won't apply to refills. It will be for new prescriptions filled. And if there are veterans who are interested in stopping their medication sooner than that, there's instructions for calling the VA pharmacy to ask for that. So that was one of the major things we talked about on the teletown hall yesterday. We also talked about the availability of flu and COVID shots. Flu shots will be available at the hospital and clinics beginning October 1st. So in just about 2 weeks, veterans will be able to have access to flu shots, both at our hospital and at our community-based outpatient clinics. We're still waiting for clinical guidance for the COVID shots, but we will have COVID vaccine available. We're targeting October 15th for availability of COVID vaccines. And again, are still waiting for recommendations from CDC and from VHA about who exactly will be identified as recommended for those shots. We continue to make progress with land acquisition for the Fisher House. We're still hopeful that that will happen. I think we've been saying that that should happen by the end of the fiscal year, which is in a short 12 days. It still does appear to be on track for that timeline. But again, no official announcements. We don't want to make any public announcements of victory until papers are actually signed and land is transitioned. But that still is looking positive. And something that will be an active discussion once we transition from the land acquisition process to the site prep process to the construction. There'll be hopefully a lot of exciting news in the coming months about Fisher House. And then last but not least, we're about to end our fiscal year. I don't want to bore anybody with the details of financial management at our VA hospital, but we do have available the funds that we need to close the fiscal year. And that is great. And we are anxiously awaiting our FY26 budget, which will tell us a lot about how we'll have to plan for next year. But that's really what we have going on. It feels like a very busy time here. If anybody has any specific questions about what's happening at the hospital, I'd be happy to answer.
Oh, go ahead, Connie.
Abe, the Rockford event sounds like a great success. Can you give us a context? How many folks are enrolled in the Madison VA clinic healthcare system, at the current time?
Enrolled?
For healthcare?
I know that we treat about 40,000 unique veterans per year. I think the enrollment number is obviously higher than that, but I don't have the exact enrollment number. I know that our market penetration is somewhere around 50%, and that varies quite a bit by county. So we know we have opportunities to see more veterans at our hospital. And part of our challenge over the last several years has been identifying productive ways to, show off the great services that we have here and convince people to enroll, evaluate their eligibility, and hopefully convince them to make the choice to join us as their healthcare provider.
Great. Thank you so much.
You're welcome. I will say we did one of these at East Clinic last month too. That was also very well attended. So I think we've maybe found some strategies for getting people out to see our facilities that have been effective. So we'll look forward to continuing to do that moving forward.
Appreciate it.
Anybody else? Okay.
Thanks, everybody.
Thanks, Abe. One housekeeping note that I forgot to mention at the top, if you would be kind enough, all participants, especially if this is your first time joining us, if you could drop your name and organization and your, if you feel like it, your email address or contact information, if you could drop that in the chat, that would be great so that we have an idea of who's joining us and we can make sure to continue reaching out to you and being in contact with you. So thank you everyone for joining us. So hi, Colleen.
Hello.
How are you? I see. So you're representing WDVA today?
I am. So Assistant Deputy Secretary Joey Hoey was going to be here, but he is still at the Capitol testifying for Senator Jacques' bill. For those who don't know, he proposed a bill sort of replacing some of the things that were taken out of the governor's budget. So this bill does three things. It provides the money for the UW Missing in Action Recovery and Identification Project. It also lowers the threshold of the property tax exemption to 80% disability. And I think what I'd like to talk about today is it would also meet the original request for our Veteran Housing and Recovery Program. Now, the biggest thing that has been happening with us, of course, is we did not get the funding we needed to keep our Veteran Housing and Recovery Program going. That was 3 locations, one in Green Bay, excuse me, Chippewa Falls and Union Grove. As of this week, we have no veterans at our Green Bay or Chippewa Falls location, and both will be completely closed by the end of this month. Luckily, with all of our partners, we were able to find alternative placements, permanent housing, or other GDP programs for every single veteran. And of course, several of them just were moved to our Union Grove location. Now, just for those of you, if this bill does go through, we would be able to reopen in Green Bay immediately because it is part of the same VISN that runs Union Grove. So that will be able to open, but because we did not renew our contract for Chippewa Falls, that would not be able to open until October 2026 at the earliest, because we would have to reapply for that grant for the GDP. If anyone has any questions going forward, please let me know. Obviously, we testified in favor of this bill. A lot of very nice things said about us by VSO leaders. Also, Kathy, I thought you might like to know that the kitchen floor at King is completely redone and beautiful, just as a nice little budget item.
Keith, go ahead.
What about VORP?
VORP was not part of this bill, but it has now reverted back to its original 12 regions from the 16.
The department didn't want to include that in the separate legislation that's being considered by the legislature?
Oh, I mean, we did, yes. We want it in the budget or in any standalone bill, but this was Senator Jacques' bill. Also, it is Suicide Prevention Month, and we have some wonderful videos going up on our social media talking about VORP and all of the suicide prevention stuff they do, including, of course, the QPR training that we provide to any group for free. So,
Colleen, if we could, I'm a little confused because I got information from the National Alliance on Mental Illness, and they do legislative updates on veterans like they do on everything else related to mental health. That some money had been restored to VORP. Is that true or no?
So we ran out of the ARPA money that was funding the expansion, and we did not get the GPR money to then continue that expanded program.
There's been no GPR money put back in to replace even a little of it.
No.
Okay. I'll let NAMI know. I don't know where they got the idea. So
sure.
How many staff will this affect?
So it affected 2 clinicians and 4 VORP reps.
So 2 MSWs and 4 outreach people?
I believe that's right. Yes. Any other questions?
All right. Thanks, Colleen.
Okay. Thank you.
Thanks so much. Yeah, and it's great to hear about the King floor.
Yeah.
Okay. Well, with that, we're going to move on to our featured topic, our guests, and then afterwards we'll come back and we've got on the agenda, then we'll do other announcements and information from other organizations. So we are going to start this portion hearing from Karina McVeigh from St. Croix Hospice, and I'm going to Karina, I'm going to remember to pause our recording at this point for you.
Participate. Okay. I just want to thank you so much for inviting me to be here today. So many people don't really, either they've never heard of end-of-life doulas, or they don't have any idea what we do or anything. And so it's always wonderful to have an opportunity to explain my work. I am a former hospice nurse from many years ago. I immediately found the part of nursing that I truly loved, working with the dying. And yet at the time of that hospice, I loved it and hated it because my personality just wanted to be with the people, to not have to be so busy, to not go in with the agendas and all the things that are required by regular standardized medicine. And it's no fault against hospices, that is the regulatory medicine. But because of who I am and a deeply, deeply spiritual, religious person, I always wanted to just spend time with a person and to offer some just presence and things like that. And so I was in and out of hospice a lot of times until I finally was able to design my own business. This was a long time ago, before end-of-life doulas were around. And I called myself an end-of-life consultant. And I did start working in my community to as much about education about end of life as it was about taking care of people. We're in the middle of what is called the positive death let me start over. Really shifting our culture into more of a positive death attitude. People are terrified. You say end of life, and boy, they bolt for the door so fast. They don't want to talk about it. They don't want to hear about it. But slowly that is changing. And to remind everyone, it's a natural part of living. It is absolutely natural. And 100 years ago, people died at home, and family members were in and out of their room constantly. They were there when they died. They were there when their bodies were taken by the undertakers, and it was more normal. And also in those days, there weren't all of the rehabilitative processes. The medicine wasn't what it is today. And so we have created a death-frightened culture. And so that's as much my passion as it is helping people to transition. Okay, let me also start. I'm a hospice nurse and then became an end-of-life consultant. At that time, when I set up my business, I reached out to two of the leaders who were establishing doula programs nationally. And this was like in about 2012 or 13. And it was just a very new thing. And so I talked to two of these people and got some really good advice as far as how to structure my business. And I ended up working with one of those people, and I became a doula giver, end-of-life doula giver. That was that company. I got excellent training. There was nothing that I didn't know, honestly, because as a hospice nurse, I had learned that and so much more. But to realize that a doula is a non-medical person. And that's what I love about my role. I come in as a non-medical person. I'm not responsible for symptom management. I'm not responsible to reorder medications or to have staff meetings and all of those things. However, I do come and work with people now and bring all of that learning with me, all of my experience. I'm working with a client right now that just came on board last week. He's still in the hospital. He's going to an assisted living tomorrow. And I've been very active with his palliative care physician, who is the one that referred him to hospice. And we've been working together, and I will follow with this person until he passes. As with any hospice diagnosis, you have to have 6 months. If your disease follows the usual paradigm or the expected trajectory, you will not live past 6 months. Many people do. They can live for years, but that is the expectation to get signed on to hospice. And so this gentleman is someone I have worked with before with his mother, and we really have a close bond. So I think the best way to explain what I do is to talk about him. When I signed on with him, I met with he and his sister. She excused herself, and we took care of the business. I have a statement of the family practice statement that I give people, and he signed that. And I have to be private pay. Doulas are not reimbursed by insurance. And frankly, we don't want to be, because then we become part of regulatory medicine and have all sorts of people telling us what we can and cannot do. And so each doula works out his or her business in the way that is right for that person. But for me, I ask for a one-time fee, and that is all of my time and energy and travel time and emails and visit time. He's been with me already for 10 days, and I have visited him for 4 times. And today I was on the phone with him for an hour. It's just an unlimited amount of time, and that's why I don't want to bill hourly. Especially when people are dying, the last thing they need to do is to worry about an invoice and then to say, no, I don't want to call her because she'll charge for it. It's just a blanket fee, excuse me, and it's a one-time payment. After that, whatever is going on with the person determines how frequently I go, determines what I do, and it determines everything. This client had no medical coverage. He was clearly ill. He was short of breath, abdominal pain, all sorts of things. He told me, he said, I think I'm dying, which is something, when I talked to his palliative care physician, I shared that with him. He said, you and I both know when people say that, they know what's going on. And so with that, I encouraged his sister to take him to the emergency department so that he could get evaluated. This is not a situation where we could wait for a new PCP, wait weeks and months for an evaluation and all the testing. So he went to a local hospital, was seen in the emergency room, and they put him in the hospital to do a workup. They did that workup for about 2 days, and then finally he told them, I really don't want to be treated. I know that my body is reaching the end and I'm ready to go. And so he simply was admitted to hospice. He met the qualifications. There are strict guidelines for that, and was put on some pain medication and digestive ease medication, and has stayed there for these days. And even his brother called to say, you said he was dying. I said he's doing much better. And that's something that happens with hospice. People get the medications they need. They get answers. No one's pushing them for more tests and more procedures. And they frequently do better, but they're still declining. So that is the beautiful blessing of that little honeymoon period. Someone is knocking on my door. Can you excuse me for 1 second? I'm sorry. That was unexpected. Sorry about that. Excuse me. So I can't remember exactly where I was, but he stayed in the hospital all this time, and he's been monitored and he's been talked to. Hospice has visited him, and they will probably admit him as he leaves, because in the hospital, they keep them on the hospital program until they're ready to leave the door, and then hospice takes over. They have to have ongoing end-of-life medical care. And so the hospice team has already agreed that he's eligible, and he will go to the assisted living and they will see him there. It's really been a beautiful walk because he has felt better. His attitude is so much better. But like today on the phone, he said, could you call? And we just talked about all of his fears, his discomfort with going to a new location, leaving his old apartment, and now going to a new facility, and knowing that he will be there because he needs the care and because he is dying. Of course, people have fears. They have deep feelings. That's what I love working with him about. That is my expertise. I actually call myself a spiritual life doula because I've studied with the soul midwives in the UK and do some really deep work with people with anointing them with high frequency oils and things like that, which I'll talk about in a minute. But I help with everything, you know, I help with making sure the advance directives. The first thing that they did was go to a bank and get the advance directives notarized so that his sister could take over the financial, get access to his accounts. You know, they put everything in place, and then they went to the emergency room, and now he will go to the assisted living. I have another client that I'm working with right now, completely different story, absolutely around the, he has a very serious diagnosis. His doctor does not give him a very lengthy life expectancy, but he's not actually eligible for hospice, which is fine. They called me in February. So I've been working with them for a long time. And they basically had a lot of steps to get taken care of for end of life. This is a family that wanted what's the monument, and I checked all that out for them, and the cemetery and all of the advance directives, and got him on palliative care and made sure everything was in place. It's just a very unique role to be a doula. My real function is to provide presence and deep presence. This isn't just being quiet and listening. I use a lot of spiritual ways to really go deep and to open my heart. And that's where these conversations with people come up. But my other client, we have some of those. They're not as spiritual. I mean, they might be in their core, but it doesn't show a lot. And when I start opening up to those things, they kind of shut me down. So I let it be, because that's my job, is to accept people exactly where they are. But the family wants me to work with them, and this client really enjoys my visits and thanks me each time. So everyone is completely different. When a person is reaching the final stages in the vigil that was being talked about before, that's usually in the active dying stage. You know, people go through, if like my client in the hospital right now, he'll probably be with us for several months, you know, but he was very sick when he came on board. We took care of business, got him some medicine, and now he will go to the assisted living and be allowed to just gradually decline. And but when that final stage happens is when a person is suddenly asleep more than he's awake, when they really become weak and need to be bedbound, and usually unresponsive. Sometimes people are very alert until the end, but that's unusual. And it's during those vigils that my work with the soul midwives has prepared me to really do some bedside rituals and celebrants. I work with the whole intimate, I call it the intimate circle, because it's not always family members, but the people who are that very intimate group that support the person, and lead them in some rituals, and use these oils that were used to anoint, like Jesus by Mary Magdalene, and they've been around for generations, and they're very powerful, and they really help the soul to transition from the body, because ultimately that's what's happening. We come into this earth as a soul coming into a physical body, and then we live all these years, and then the soul needs to be released into the next period of that evolution. And that's really what is happening with the dying process. Excuse me. In the work that I'm doing now, really helps. I did bring one of the oils to my client when I met with him the first time and explained to him what it was, and I anointed him, and we had the most powerful moment together, and he really did feel better afterwards. It's not necessarily a physical better, it's the soul is, you know how it is when you have a soul that's out, is hurting. You can say his soul is hurting. That's what deep physical and mental trauma, that's a soul in pain, and so this can reach it on the soul level. But that's just one of the things that I do lots of other. I did want to, can I share one slide?
Yes. Yes, go ahead. You should be able to just share your screen.
Is it showing? Now let's go back. If I don't have, can't do it, that's okay, but I'd like to. I'm not sure it's telling me where I can share.
I think down at the bottom, there should be a green arrow.
Okay. Well,
It
now
says
I've goofed
share.
everything up. Okay. Green arrow. I know how to do it when I'm the presenter.
When you're controlling. Yeah.
Yeah. Okay, we'll let it go. What I wanted to talk about is, I mentioned that I was part of the original groups that were forming programs, and that's when I became aligned with the doula givers. But in 2018, the National Hospice and Palliative Care Organization recognized the role of end-of-life doulas. And that was huge for us because I think that anybody knows that medicine doesn't really like integrative health and all these other things. They tolerate it, but they're not really endorsing it. And this changed things for our profession. First of all, it made us a profession because there is a competency badge that anyone that's listed on their doula directory has passed, and family members can go to a directory online now and get the names by state and area of the doulas that register with this. And it's called the National End of Life Doula Alliance organization. The website is www, and this is all one word, nedaalliance.org, NEDALLIANCE.org. And NEDA has all of our code of ethics, scope of practice, all of the important things that legitimize the doulas that are on that directory. That people have been doing this work for years. They always just did it, and in many small communities, you knew who to call to be with someone when they're dying. But this makes it into a profession, and it has allowed us to be recognized and to be for hospices and others to refer us. They can see that we pass a proficiency badge in that. It's a slow go. Hospices are very slow to use us. They're not against it if the family calls us, but I personally have never had anyone refer us. I'll be glad when that happens because hospice, I adore hospice. I have not one bad thing to say about the care. I couldn't do my job without hospices. They're the people that handle all of the medical orders, the medications, and all of those regulatory things. But they're not there all the time. They're there intermittently. That is just how hospice is set up. They teach the family how to care for the person, and then they go and come, which is what they should do. As a doula, I can be the one person that's the constant. I'm not usurping anybody's time or job or anything. That a few times that I have worked as a doula with clients who are on hospice, as soon as I see the hospice nurse, ask the client if we can all talk together, and I kind of update the nurse about what's been going on from my end and any of the discussions we've had so that we can be a real team. And it really works well. And truly, patient satisfaction scores are much better when there's a doula involved. So I'm tooting my professional horn and hoping that people will use us. So
And
I guess I'll
we'll
leave
be
it.
sure,
Yeah.
Margie, to share the website. And I looked it up on my phone as you were giving it, because especially for the directory,
Mhm.
I know when I've just done just kind of a Google search for doulas or doulas in the Madison area or something like that, and it's the returns from Google. I mean, it's kind of like, I was wondering, it's like, why isn't there just a directory of doulas?
Mhm. Yeah.
So thank you for sharing that. And we'll
Well, in
be
Google
sure to.
searches, excuse me, the doulas many doulas don't want to have a big website. Those are expensive things and stuff. And so they kind
Mhm.
of just go word of mouth. And so the directory really helps.
So it sounds like the role of a doula could be kind of everything from like this administrative helping. You mentioned the advanced directives and making sure or helping that individual activate those to just being your presence and with them. How should a person or what things should a person look for when they select a doula? Because I mean, this is such a personal experience, and each doula is going to be so individual. How does an individual kind of assess or determine which doula is going to be appropriate or right for
Well, I
them?
think that they should contact several people. I always offer a free online consultation because it needs to be a fit for me with that person and vice versa, or it won't work. I've never had to turn anybody down, but it's important to it's more of a personality thing than anything. And certainly to make sure that they have the experience that you want them to have. And that's where with Nita, you can, count on that. But there's other people out there that are doing the work that.
So, are there other questions from the audience?
I just have a comment, Margie. We work with, I refer to a death doula in Baraboo I recently connected with. So I
Oh,
really
good.
appreciate the work that you guys do. It's amazing. And I hadn't really had a chance to sit down and have a meeting with a death doula before. And it's just really wonderful that we're able to partner with you all.
Thank you. Thank you. Well, and people reach out to me who are interested in becoming end-of-life doulas. And we talk a little bit, but then I ask, what kind of doula are you? And they're kind of not sure what I mean, because I bring my hospice background. I bring all of my deep spirituality, my love of spirit and soul to the table. So I tend to attract people who are very spiritual, and open to those things. I don't push it on anybody. It just happens, with the law of attraction. But I've had doulas. One person that I worked with wanted to assist suicide victims' families because she had experienced that so many times in her life and realized the loneliness, and so to have a death doula come to the hospital and then walk with them after. There are some, I've had other doulas who are legal aides and they are more interested in the legal forms and things like that. We can do it all, but everybody has their own background and their own things that they bring to the table.
I'm not seeing any other questions. And what, I guess, how does a person, I mean, the coming to a doula or coming to that, are most of your contacts, when people contact you for your services, is it the individual or is it a family member that, or is it kind of a combination of both, where does there have to be kind of an acceptance by the individual that
Oh, yeah. Yeah, no one's I would never allow anyone to force a doula on their loved one, and I don't think it would ever happen that way. But yeah, most of the time it's the family member calls me after talking to the person who's ill. I did have one client, one of my very most dearly loved clients. I worked with her for almost 2 years. She called me and said, and she was real in charge kind of person. I'm stage 4 colorectal cancer. I'm not ready to die. I'm still on chemo, but I want someone to walk with me because I'm afraid. I said, sure, and I just loved her because she was always in charge, always, did it her way. But it was so early, and I was able to walk with her while she decided to stop therapy or treatment. And she just died in March. I miss her.
that must be, I mean, that's another aspect of what you do, is you're in relationship with each of
Oh,
these
deep relationship,
individuals.
very
So
deep. Yeah. I don't worry about professional boundaries. I sort of inherently have them. Let's put it that way. I've been around a long time. I don't cross a line, but you're talking soul to soul, open, bare heart, and with the family too. But and I talk to them, the family members through the bereavement period a lot. And then finally they stop calling and that's fine. Then we're done. This is not a lifelong relationship. This is simply a very intimate sharing of a very special time in their lives.
Thank you so much, Margie, for sharing this information and sharing your stories. Last call for questions for Margie or Karina. Jen, thanks, or Jess, thanks for your comment. Jess said, really great info, conversations and information is so important and also not discussed enough with normalcy. Jess, I agree. Okay, we're going to move on to the kind of the final part. We've got announcements from organizations and individuals. Does anybody have something that they want to share? Hi, Molly.
Hello. Can you hear me?
Yeah.
Oh, good. I just wanted to say that the QRF, the quick reaction stuff that you guys got going, the pilot program, it's really helped two of our veterans. And so that's been great. For those veterans, they've really appreciated that. So I just want to let you know we're getting positive feedback on that. So that's awesome.
Thanks, Molly. It's good to hear. And I know that we're really happy to be able to step in and provide that.
Yeah.
So I've got some items to share on behalf of the ADRC. And Jennifer Fisher was unable to join us, but she sent me a number of items. So I'll just put a plug in for them now, but then also include them in our newsletter. So there's what is called the Savvy Caregiver Knowledge Skills Mastery. It's a 6 weeks course for family caregivers caring for persons with Alzheimer's disease or related dementias. That is weekly on Wednesdays, beginning October 1st in Verona, October 15th from 10 to 11:30. The ADRC, which is the Aging and Disability Resource Center, and the Office for the Deaf and Hard of Hearing are having an event. And I think it looks like it's just an introductory event, but that's October 18th, or pardon me, October 15th. There is a 4-week program for people who have mild memory loss or the early stages of Alzheimer's disease or dementia and their primary care partner. It's called Crossing Bridges, and that is on Thursdays from 1 to 3 during the month of October, beginning October 9th at the Monona Senior Center. There is a caregiver appreciation event on November 3rd from 8:30 to 11:30 at Olbrook Gardens. And finally, a program called Caregiver GPS. Learn how to navigate the journey of caregiving. It's a 90-minute session on the benefits of therapy for individuals experiencing cognitive change. That'll be November 20th from 12 to 1:30 p.m. These were all sent to me from the ADRC. So if you heard anything that interested you, you can visit their website at www.wisconsin www.danadrc.org. So that's plugged from the ADRC. Does anybody else have anything? Tom Parr, are you going to be quiet this whole time? Nothing?
I have actually nothing.
Hey, it's Connie. May I
Well,
ask, if this may be on the website and I missed it, anything on the stand down that you would like to say now? To give folks a heads up and see who, how
They've-
this works.
So Stand Down Madison they've got the stand down coming up in October. That information is on our website. And more information will be in the newsletter, but they're always seeking volunteers. And that again is, if you're unfamiliar with Stand Down, they do a day-long event for at-risk veterans, and they provide services and assistance to veterans. It can be showers, barber services, connecting with service officers to assess their benefits, help them apply for benefits. It's a volunteer intensive event in need of volunteers. And Jess, hey Jess.
Hello. Waiting for my camera to turn on. There it is. So I put a couple things for Team RWB in the chat. And then I did want to, it's not my event at all, and I don't run the at all, but I want to mention that the Operation Ruck 22 is having one last ruck. I think they've done it for 10 years now, and that I know it's the last one. One of my friends is on the board, so that's on the 27th of September. Right? Yeah. Sounds right. Yep. And it's just really valuable. It's used to be 22 miles, now it's 22K, which is around Lake Monona, not Mendota, Monona. And you can also do just pieces of it. So that was something I wanted to just make sure that folks knew about.
And that's okay, Operation Ruck 22, and it's on September 27th.
Yep.
Okay.
And then they started at the Cottage Grove Road VFW. And then it's the sign up, you can sign up all the way until the day of.
And where should they go? Where should people go for more information on that?
I don't know the website off the top of my head, but
can they contact you, Jess? Or
yeah,
is there
they can feel free to. Yep. Yeah.
Okay.
And it's like $10. So it's nothing that is expensive.
Thanks.
Yep.
Anything from Sauk County? Jenny, it's nice to have you join us. And I saw that Tony was on earlier.
Oh, sorry, I just stepped out. I came back.
No, sorry. Blindside you, put you on the spot. Sorry.
No. Are we introducing ourselves? No.
Yeah, well, and I was just wondering if you had any announcements or anything that, anything going on in Sauk County that you wanted to highlight.
No, we're just glad to coordinate with everyone and be on the same page and understand the resources that are available for our veterans. And I've got Becky and Louie here too, so we've all been listening.
Great. Well, thanks so much. We appreciate you being on.
Yes, thank you for having us.
Okay. Any last thoughts? Maybe I should look at these see if there's any comments. Oh, if you're not tracking the comments, Colleen Flaherty did make a note that regarding VORP, just a clarification, that they went from 16 regional coordinators to 11 regional coordinators. So just a clarification on that. And an item from an announcement from Steve Westfall. He's from the Milwaukee Regional Office of the VBA. He said, invites anyone that if you have any upcoming veteran-centric events and would like VBA attendance, reach out to Steve, and he's steven.westfall@va.gov. And he can have one of his specialists or himself attend to answer questions related to claims or what the VBA does and the regional office staff do to assist veterans. So, and if you missed that email or you missed any of the websites that we announced, just reach out to us at info@VetsCAN-WI.org and just ask for any of that information. So thank you, everyone, for being here. We look forward to seeing you, hopefully, at our next engagement forum on October 16th, and also at our in-person event on November 20th. Thanks for joining. Take care.